One of the areas in oncology that have not had a lot of integration of palliative care is actually hematological malignancies, primarily because patients with hematological malignancies are pursuing curative therapy. And so the question is whether palliative care can help this patient population or not. So we are actually doing a study where randomized patients who are with hematological malignancies who are admitted for hematopoietic stem cell transplant or bone marrow transplant. Just to give you a little bit of a background, this population are patients who receive high-dose chemotherapy during a very intense 3 to 4 week hospitalization, and that's their bone marrow transplant hospitalization. Studies have shown that these patients experience a substantial physical and psychological symptom burden as well as quality of life deterioration throughout their hospital stay. And the question that we ask, can palliative care involvement, a team of doctors and clinicians that really specialize in managing complex symptoms, can they help patients with hematological malignancies receiving bone marrow transplant? So the intervention entailed palliative care clinicians being integrated as part of the oncology care for this population, and they were seen by the palliative care clinicians throughout their hospital stay at least twice weekly during the hospitalization for bone marrow transplant. So patients were randomized to receiving that palliative care interventions versus receiving their standard transplant oncology care. And what we noticed is that patients who were randomized to the palliative care intervention had drastic improvement in their quality of life, lower depression, anxiety, as well as lower symptom burden compared to those receiving standard transplant care alone. In addition, the family caregivers of patients that were randomized to the intervention also experienced some improvement in their coping as well as their depression during their loved one's hospitalization for a transplant. So we now can say that palliative care doesn't only help patients with solid tumors, but it also the benefits of palliative care can extend to patients receiving curative therapy and patients with hematological malignancies.